This is a review of the literature on the topic of lateral violence among nurses. I'm Frankie Garrett. So there were a couple of questions that I was thinking about or kept in mind when reviewing this literature. The first one, what would be the effects of increased awareness and literacy among nursing staff surrounding the current levels of lateral violence that is happening in the nursing profession? And secondly, will increasing awareness and education regarding lateral violence in nursing among ancillary staff lead to a decrease in said violence? So some keywords and their definitions from the literature. Lateral violence, also called LV, or horizontal violence, or HV. These are both overt and covert aggressive behaviors exhibited between individuals on the same power level. So it's not necessarily a struggle between a manager and their subordinate, but really among nurses, regardless of their experience, who are on the same level at work or in their department. Organizational culture, the underlying beliefs, assumptions, values, and ways of interacting that contribute to the unique social and psychological environment of an organization. If you have ever been employed anywhere, you have been exposed to that organization's culture, and there can be both positive and negative aspects to that culture. What I've found from the literature is that oftentimes there is an organizational culture of acceptance regarding lateral violence. Cognitive rehearsal is a learning approach that can equip nurses with the skills to respond to situations of incivility or aggression and protect themselves and their patients. So while in the ideal working environment among nurses, we would want to see zero lateral violence and therefore very little need for a tool such as cognitive rehearsal. The truth is it is still occurring every day among all different types of nurses, and so we need to equip all nurses, but especially new and graduate nurses, with tools to respond to situations of aggressive behavior or incivility in ways that will de-escalate the situation. So what exactly is lateral violence, or what does it look like? So overt behaviors, these are ones that would be very direct and visible by even other people, would be shouting, name-calling, fault-finding, intimidation, gossiping, withholding information, and breaches of privacy and confidences. Covert behaviors are ones that are more subversive and maybe happening in the background, either with or without the victim's knowledge. And that would be the use of sarcasm, eye rolling behind the back, refusing to work with someone, exclusion, especially from certain social situations that occur at work, like maybe taking a break together or taking lunch together, lying to a coworker, lying about a coworker. And because only about 7% of communication is verbal, the covert behaviors can be a lot more impactful on the victims. So some possible causes, according to the literature, can be lack of awareness among non-nursing staff. I did some very informal interviews with some of my non-clinical coworkers, and I was surprised to learn how little is known about lateral violence among nursing outside of nursing. There can be lack of awareness among mid and upper level management. So these are not nurse managers, but administrative managers that are managing nurses or departments with nurses. As I mentioned before, there can be an organizational culture of acceptance many times in the literature, it was referred to as quote unquote eating their young, speaking of experienced nurses and their relationship with novice nurses. And that's really a cycle that needs to be broken. But the literature has revealed it is still out there and very prevalent. Another possible cause can be oppression theory. Oppression theory in this case refers to nurses feeling that they are from an oppressed population. This stems mostly from the physician-nurse relationship, but has actually trickled down to nurse-on-nurse relationships, where the nurses feel that they are powerless, they have little to no autonomy or decision-making abilities, and this leads them to accept that this culture of aggression and incivility is normal and a necessary part of their training. The impact of lateral violence in nursing spreads far and wide, and I can only touch on a few things here. It starts to manifest in behaviors such as absenteeism. We see more call-ins, staff turnover, nurses leaving departments or units, and sometimes even leaving the nursing profession altogether. The road to burnout becomes much shorter. Burnout is an issue that nurses have dealt with and maybe always will deal with due to the physical, emotional, and mental toll. But when you heap lateral violence on that already sort of full pile, burnout can occur much quicker. Decreased safety and quality outcomes. If there is little emotional or mental support, new and novice nurses feel less safe to ask questions if they have some, and that can lead to more mistakes. And then the overall patient experience can become more negative, not only in safety and quality, but just in general. If they do not feel that their nurses are working as a team, then they can start to feel a decrease in confidence and trust in their caregivers. Some coping and solutions from the literature are awareness and literacy training, not only among nurses, but outside of that nursing staff, so that people can recognize what it looks like when they see it. Depersonalization of lateral violence. We do not want to encourage or condone or justify lateral violence, but as long as it is still occurring, we need to teach new and graduate nurses how to depersonalize that. We need to give them tools such as cognitive rehearsal and cue cards, which can have phrases or conversation starters to get them started talking to the nurses that are acting aggressively or uncivilly. Phrases such as, I feel there's more you want to say to me about this. You can feel free to speak to me directly. That can be a very difficult thing to say, but it can maybe open up a line of dialogue. We want all nurses to feel empowered. New and graduate nurses may come in with less clinical experience, but they do have a lot of knowledge, and so that needs to be valued. And then the experienced nurses need to share that experience with the new nurses so that we can have a very, very valuable team of caregivers of all experience levels. Mentorship programs. There were some studies done about mentorship programs. The most effective ones actually had nurse mentors that were from different units or departments so that the novice nurses felt comfortable talking to them. And then going back to basics, we just need to have some defined professionalism standards among nursing professionals. There were some gaps in literature and opportunities for future research. There's been too little research regarding the impact of any of this kind of training, both literacy and cognitive rehearsal. There need to be larger sample groups for studies and more follow-up done 3 months, 6 months, a year, 2 years, 5 years down the line. And then there needs to be studies done on an impact of a standardized reporting system. Thank you so much for listening, and I hope that this gives you a little bit more information about lateral violence in nursing and what it is and how we can hopefully begin to decrease that.